Hello, everyone, and thank you so much for joining us for today's Lunch and Learn. We have our second edition in the Statewide Opioid and Substance Use System Update. Stephanie Cook will be discussing current state programs relating to this topic. This is also the second in the pre-legislative session webinar series, so we do have more sessions coming. Let's see. Before we get going today, let's go ahead and review some housekeeping. So this webinar is being recorded. Recordings will be made available on our partner website. So that will include the All Regional Behavioral Health Policy Board website, which is nvbh.org. We are also going to make the recording available to our partners at Behavioral Health Association of Nevada and the Nevada Public Health Association, so they may also post them. Please keep your microphone on mute at all times unless you are called upon. We're going to go ahead and wait for questions and answers until the end. So I do reserve the right to mute people who are not on mute. So please just try to be mindful of that. As far as the chat is concerned, the chat is working. So please enter your name, title, and agency in the chat so that we know who is with us today. And if you do have a question during the question and answer period at the end, go ahead and use the raise hand function to ask your question. This is a collaborative project brought to you by not only all 5 of the regional behavioral health policy boards, but also the Nevada Public Health Association's Advocacy and Policy Committee and the Behavioral Health Association of Nevada. The purpose of these webinars are really to help you, the participants, get a current and up-to-date snapshot as to what's going on in the state's behavioral health systems at this time. We're doing this previous to the legislative session because we know that there's always things that come up regarding behavioral health in the sessions, and we want to make sure that you have the most current information possible so that you can be informed as to what the effects might be of bills that do or don't pass. This is not a lobbying effort. This is simply educational. We've also made efforts to include speakers who are subject matter experts in this series and who are able to give information without any sort of political or financial gain whatsoever. We do have some upcoming webinars scheduled. This coming Friday at noon, we have one more with Stephanie Cook where she's going to talk about future state programs. Next Tuesday, the 22nd. It's Tuesday, the 22nd and the 23rd. At noon, we've got Behavioral Health Workforce Development, and that will be Dr. John Packham talking about the most up-to-date behavioral health workforce data and reviewing that, what it means, any issues with that data. This is really important when we're talking about bills that may affect workforce. He will also be discussing the rollout of the 2025 Rural and Frontier Health Data Book. On Monday, the 27th, we have Advocacy 101, which is engaging in the legislative process. That will be presented by Elise Monroy with Cartwright Nevada Government Affairs, who was hired by the Nevada Public Health Association, not only as their lobbyist, but to put together this Advocacy 101 toolkit. On Friday, the 31st, she will also be presenting on how to read, understand, and use state budgets within your advocacy and education work. So making sense of where the dollars are, so what can happen and really what can't, because as we're all well aware at this time, if there's no money, it doesn't happen. Other webinars that we're working on scheduling, we're going to do a couple different sessions on the crisis response systems. So what the past is, what current plans are. We're also working on getting some sessions scheduled regarding crisis stabilization centers and what goes into making those and what some of the hangups are. Why don't we have more of them? The big topic of conversation in behavioral health right now is mobile crisis teams. We also want to do a session with youth behavioral health, and we're also going to talk more about behavioral health development, workforce development rather, what other current programs and projects are undergoing, how to engage with legislators, and of course, my counterparts and I, and hopefully our board chairs will be able to join us, talk about each board's bills and kind of what our policy priorities and perspectives are. A little bit about the behavioral health policy boards. There are currently 5 behavioral health regions. Each one is served by a board. These boards are completely voluntarily staffed by different appointed and other folks who have been voluntold members. There's 7 to 13 members. They represent various parts of behavioral health systems, including different professional perspectives, as well as their local perspectives from where they're located. The purpose of the boards are to advise state level agencies and commissions as far as what the local needs are, what's working, what's not. And each board is allowed one BDR each legislative session. Within these different boards in the regions, obviously Washoe is just Washoe County. The Northern Regional Behavioral Health Policy Board is really focused on the Western rurals. In blue, that's the region I serve, and that's 6 of the northeastern rural and frontier counties. The green section, the Southern Behavioral Health region, is the kind of central, south central frontier counties. And then Clark includes not only Clark County, but also the southern tip of Nye to include Pahrump because of service delivery. Each board has a coordinator. We are the unofficial staff, and really our primary role is to act as a liaison between the board, our local community agencies, and also the state, and helping connect them, problem solve, figuring out what needs to be done. We are funded by the Nevada Division of Public and Behavioral Health's Bureau of Behavioral Health Wellness and Prevention through overdose data to action grants and mental health block grants. This is the contact information for each of our current regional behavioral health coordinators. The Clark RBHC position is currently vacant. Again, this is a collaborative project from not only the Behavioral Health Policy Boards, but also NPHA and the Behavioral Health Association of Nevada. And with that, I am going to go ahead and stop my share so that Stephanie can go ahead and start her presentation. Thank you so much to all of you who are here. And Stephanie, take it away.
Awesome. Thank you so much, Valerie. And thank you everybody for being here. Let me get my stuff put together. Are we all good here? Valerie, can you see that?
Looks great on my end. Thank you
Okay.
so much.
Awesome. Again, good afternoon. My name is Stephanie Cook. I will be presenting. This is the second presentation on funding for substance use initiatives. On Monday, I talked a little bit about the federal agencies that oversee substance use initiatives and kind of collaboratively work with states and local jurisdictions on those activities. Today, we're talking about state funding for substance use initiatives. And then on Friday, I have additional information relating to future growth in this space. So I am located within the Division of Public and Behavioral Health. Our mission is to protect, promote, and improve the physical and behavioral health and safety of all people in Nevada, equitably and regardless of circumstances, so they can live their safest, longest, healthiest, and happiest lives. Our vision in Nevada is where preventable health and safety issues no longer impact the opportunity for all people to live life in the best possible health. And our purpose is to make everyone's life healthier, happier, longer, and safer. So the agenda today is to start with an introduction of myself and the Bureau. Also to touch on, before I get into the nitty-gritty of all the dollars and initiatives, I'll touch on a couple other known funding in the state that I do not oversee, but have some interaction with and provide some resources in that space. We'll then review the federal grants that are located here within our Bureau that are statewide, that oversee substance use initiatives, along with our state general fund accounts that we utilize to fund these services. We'll touch a little bit on substance use certifications that is overseen by our Bureau, and then wrap it all up to question and answers. So first, I want to start, every state has a lead agency that oversees and manages federal funds dedicated to addressing substance use prevention, treatment, and recovery. We refer to these as SSAs, single state agencies. Our administrator, Cody Finney, is our SSA for the state of Nevada. This responsibility is also delegated down to our Bureau as we have the oversight of the various programs for substance use. I serve as the State Opioid Treatment Authority, which means I have oversight of the opioid treatment programs in our state, really ensuring that they're adhering to federal and state law as it relates to the safe opioid use treatment in our programs. Linked here is a couple of our National Association reports on what that means in more detail for both the SSA and the SOTA. So an introduction to the Bureau of Behavioral Health, Wellness, and Prevention. We oversee various things within our Bureau. One part is our community mental health services. I listed here some of NRS 433 and NAC 433 as it's not the statutes and administrative code in its entirety. We have our substance use prevention, treatment, and recovery services programs as outlined in NRS and NAC 458. Within there, we also it also identifies the certifications of our programs, substance use programs. Housed within our bureau is also the Office of Suicide Prevention, as outlined in NRS 439 and NAC 439, and Crisis Support Services, which is also parts of NRS 433 and NAC 433. Our bureau chief is Shannon Bennett, if anyone is familiar with Shannon, and then I serve as the deputy bureau chief. We have various other programs within our bureau. A lot of it represents co-occurring supports. So as we know, many individuals with a substance use disorder also have mental health or gambling challenges. And so we do have other supports within our bureau. This presentation today is focused solely on substance use. So if there's any additional questions or information needed, I'm happy to provide resources to that as well. So before I get started on federal and state dollars within our bureau, I want to touch on a couple other known funding sources in the state. I've listed here the Funds for Resilient Nevada, which is our opioid settlement dollars operated through the Director's Office of the Nevada Department of Health and Human Services. The link attached here is information that can be found regarding the initiatives in the program for the Funds for Resilient Nevada. Also linked here is the dashboard. They've put together a really nice dashboard of the initiatives they're funding and kind of where the money's going and how it aligns with their plan. Also in our state is the COSUP grant, which is the Comprehensive Opioid Stimulant and Substance Use Program. This program is currently managed through the Attorney General's office. The intent is to address substance misuse in Nevada through either the enhancement of existing or the implementation of drug deflection or diversion programs. I've linked in the information to their website on the Nevada initiatives for the COSUP grant, and then federal information on that grant as a whole can be found on the BJA site listed there. As a footnote, also, there's other substance use programs that are sprinkled within various settings throughout the state. For example, the Department of Corrections has a residential treatment program and various other programs for those in that setting. And there are different kind of programs embedded within other state agencies. The information we're looking at today is just kind of statewide initiatives run through our bureau. A quick disclosure, because I think it's important to know that the information I'm presenting today is current activities, and you'll see a lot of it relates to either the state fiscal year 25, so the current state fiscal year we're in, or it aligns with the federal fiscal year 25 for our federal grants. So you'll see that information throughout here. They are different fiscal years. So our state fiscal year starts July 1st, and most of our federal fiscal years start October 1st, although we have some that vary, whether September 1st or September 30th. Okay, so we will get into federal grants within our Bureau for substance use programming. The first federal grant we'll talk about is the Substance Use Prevention, Treatment, and Recovery Services Block Grant. We refer to this as the SUPTRS Block Grant. This is administered through our federal partners at SAMHSA. Also is our State Opioid Response Grant, our SOAR grant, which is also administered through SAMHSA. Our Strategic Prevention Framework Partnership for Success grant is a discretionary grant that is also administered through SAMHSA. And lastly, our Overdose Data to Action for States grant is administered through the CDC. Starting with the SUPTRS Block Grant, This is a federal block grant to reduce onset and progression of substance use. Every state receives this block grant, and based on the information outlined in the Code of Federal Regulations, we have kind of guardrails to follow as to what is allowable and unallowable. These dollars are meant to really look at gaps in services in our state. So with the key objectives of prevention, treatment, and recovery services. Every state looks different in their needs and what they're aimed to focus on. Every Medicaid system is different in each state. So utilizing this block grant is important for us to work alongside the other systems in our state to ensure we're utilizing these dollars for the gaps that we have throughout our state. We also help to fund new initiatives through our block grant and get them up and sustainable, and then move on to new initiatives. We know in the substance use space that things are constantly moving. There's always new things happening. There's always new new initiatives to combat the crisis we're in as it relates to the opioid crisis or any other, polysubstance use right now. So utilizing these dollars are important for our state to really fill in the gaps as needed. Currently, we're receiving a $20.5 million block grant yearly to address both prevention, treatment, and recovery services. I have noted at the bottom here that our Bureau during COVID received $30.2 million that will be ending this September related to COVID and ARPA associated with this block grant. These dollars were used to support substance use prevention, treatment, and recovery services through the pandemic. These dollars are separate from any other state ARPA dollars, whether through the governor's office or anywhere else. These are specific to our block grant and must adhere to all of our block grant requirements. So just as a note, we are, that $30 million is ending here in 8 months. Some initiatives, there's a lot to this slide, and I'll point out a few. Some initiatives that we focus on currently in our block grant in the 3 categories are really supporting activities for data collection for our surveys that go out to our youth. A lot of our prevention activities, not all, but most of them are geared towards youth in our schools. So really looking at the data, investing in those surveys to ensure that we're meeting the needs of our youth and really understanding kind of what the landscape looks like out there. We fund activities relating to SINAR, which is the retailer education relating to the sale of tobacco. So there is a law, the SINAR law, that requires education to our retailers to ensure that we're not selling tobacco to our youth. And this also includes all vape products. Currently, we fund 16 prevention coalitions or programs throughout our state, really looking at upstream approaches to primary prevention to engage with not just our youth, but their families. We've got veteran populations that we're looking at, LGBTQ adults kind of statewide, and tribal communities within our state. Next is treatment. We fund a standard fee for service for substance use treatment. Right now, in transition, we are funding residential services and transitional housing in our state. So residential services is where somebody, comes into a entity and they're living there for a certain amount of time based on the need, their treatment need, based on kind of client-centered approach to treatment. Transitional housing is where someone lives there, but they're allowed to leave and go have a job and seek out treatment services, but come back to a place that they're staying that's managed. Right now, we're in a transition, and I'll talk about this a little bit later, with transitioning residential services as a Medicaid covered benefit, thanks to our friends at Medicaid that have worked hard on their waiver to include those services within the Medicaid plan. So I'll talk a little bit about that later, but that's currently the 2 major treatment aspects we are focusing on with this block grant. We also do some project-based activities to really support those that are in treatment with wraparound services to ensure we're not losing people. In this process, we know that everyone's path to recovery looks a little bit different. Not everybody completes a treatment program, and that's all they need. Like there's a lot of wraparound social determinants of health activities that we work on to make sure people are supported in their journey. We also have specific programs for women and children, really looking at wraparound supports to keep them engaged in the process and on their path to recovery. Recovery initiatives. Nevada is one of the first states to intentionally carve out recovery services from its block grant to fund and track these initiatives. There's been a couple pushes at the federal level to have this as a carve out. We do have some carve outs in our block grant in which we have to fund specific programs. The feds have tried to do this on this block grant and haven't been successful in the last couple years. And so Nevada has intentionally done that to really focus in on the next step, which is supporting those in recovery. With all the wraparound services that are needed to really bring those people some supports that they need to live a healthy life. We do project-based programs in that space, not otherwise funded. We also look at kind of whole health approaches to recovery through a community recovery center in Clark County. And then we have a program with that's looking at men's-based services for wraparound recovery supports. So all of that, kind of in a nutshell, way more than that really occurs in this block grant, but those are the highlights. Okay, so moving on to our state opioid response grant. This grant is awarded for the current federal fiscal year, $16.6 million. This is a discretionary grant. So unlike the block grant, this discretionary grant has a lot more parameters around it. The feds look at this grant more and are more strict with the movement of money in this grant. It really supports efforts to increase access to evidence-based harm reduction, prevention, treatment, and recovery for individuals with an opioid use disorder and a stimulant use disorder or stimulant use disorder. The tricky thing with the SOAR grant is it cannot touch individuals or provide services directly to those with an alcohol use disorder unless it's a co-occurring with any of these others. So the state utilizes our block grant to really focus in on the alcohol related treatment if that's the only diagnosis. Because this grant is a little more strict on what it can cover. These funds are also overseen and distributed by SAMHSA. A couple of the high-level objectives are to expand access to treatment. We know those with opioid use disorders have limited access to treatment for various reasons. Enhancing prevention efforts in this space, supporting recovery services, and to reduce overdose deaths. Very small text on this screen. My apologies, but when you get the slide deck, you'll be able to see this. These are a bunch of grant-funded initiatives within SOAR. I won't go through all of them, but SOAR is working on initiating all these grants for this current year. We're looking at really stigma is a huge issue as it relates to someone with an opioid use disorder, trying to access services, trying to understand medication for opioid use disorder and how to get that and where to get that. Really looking at harm reduction in the SOAR grant, trying to expand distribution of harm reduction efforts and overdose prevention outreach. This relates to our naloxone saturation that we have in our state, in every state, really trying to get naloxone in the hands of a majority of folks in our communities, so it can be used in times of need, and that people understand and are familiar with what naloxone is. Working on high-level projects, really to community drug checking in Washoe, really looking at uplifting that program for our communities. And then the last one I'll highlight is kind of the wraparound support. So really looking at those in treatment, what are they missing out on in their lives that's preventing them from receiving treatment. We know that a lot of times that's going into a residential treatment facility means you're away from your house for up to 45 days, and you still have rent or a mortgage to pay, you still have utilities, and all these things. And so really looking at leveraging our federal funds to help support those to receive treatment so that no longer becomes a barrier. And then lastly, just justice involved in youth and within our Department of Corrections and other places too, but really looking at expanding access to medications for opioid use disorder and how we can kind of go upstream with our youth and provide educational opportunities and other supports in that space. Moving into a pilot grant that we currently have, the Pregnant and Postpartum Women Pilot Grant. This is a federal discretionary pilot grant focusing on supporting comprehensive family-centered treatment services. The primary aim is to improve health outcomes for both mothers and their children. These funds are also overseen and distributed through SAMHSA. We are currently being awarded $894,000 for federal fiscal year 25. We are in year 2 of a 3-year pilot. So SAMHSA released this competitive grant as a 3-year pilot to really study the need for these services in our state and let us pilot a program to expand services and report back on the success of this grant. Most likely SAMHSA, if dollars are available, will make this, if it's a successful program, we may see this become a regular discretionary grant in the future, if that's where the federal administration wants to go. So this is currently a pilot. A couple of the key objectives are really looking at comprehensive treatment services for women and women with children and postpartum women, really surrounding them with the wraparound services, because we know how hard it is to have a baby, and these women are living with a substance use disorder as well. Looking at family-centered approaches to keeping moms and babies and families together, and really touching in on the treatment needs of the mom and others, to ensure we're taking the family-centered approach to treatment. And of course, as sprinkled in with a lot of our programs is recovery support services. We know that it's evidence-based practice to utilize peer recovery support services or specialists within all of our programs, as those are the folks that truly make a difference in our space. We uplift all of their services and fund a lot of their kind of workforce development initiatives to get our peers certified and into the right spaces. We know this is truly what makes a difference in all of our work. This pilot project for Nevada is called the Empowering Nevada Project. If you're familiar with Roseman University, they are located in Las Vegas. This pilot project supported Roseman University's program to expand to Northern Nevada, serving Reno, Carson City, Story, Washoe, and Lyon counties. The goal was to increase the adoption of universal screenings for pregnant women, addressing the barriers to access to care, especially care coordination between in this population, decreasing the gaps in the continuum of care, and improving the implementation of care plans of care, and to really focus in on the facilitation of referrals and following up on those referrals as it relates to infants that are born exposed to substances. The core service goals for this specific grant is to expand direct services, really targeting this high-risk, underserved population. We know that by surveying Northern Nevada and the access to care as it relates to these types of services, it was important to pilot this project in Northern Nevada, as Roseman University has been very successful in Las Vegas and all of their efforts in Clark County. Addressing the critical gaps in NAS mitigation and prevention, Again, providing family-based treatment, really trying to keep the family together. It's important that we support moms in their treatment efforts and their recovery efforts, but also trying to keep the family together, as we know that will provide, more, it'll make it more of a difference in the long run. And managing the social determinants of health as it relates to this population. All of the grants that I've gone through so far, federal grants that we've gone through so far, have all been mostly focused on treatment and prevention and recovery services. This specific grant, the Partnership for Success grant, is a federal grant, a discretionary grant from SAMHSA, and it is solely focused on prevention, community level prevention as it relates to youth services. And so we utilize this grant to really target our youth and go upstream to ensure we're providing necessary supports to our communities so we can see community level approaches and outcomes as it relates to our youth. The key objectives kind of globally for this grant are to prevent substance misuse, to build prevention capacity in our states and the infrastructure associated with that, and to promote long-term sustainability in these prevention efforts. Currently, this award is in year 1 of its funding, year 1 of 5, and we're receiving $1.2 million for these efforts. A few of the goals that Nevada has identified for this funding source is to reduce suicide among youth and young adults by 2% each year. I'm really looking at the data and ensuring we're targeting the right populations when we're looking at this, and really ensuring we're meeting these youth where they're at to ensure we're making a difference in this space. Next, to reduce onset of not just tobacco. Tobacco numbers are very low in youth right now. It's more the vaping in our youth ages 10 to 17, trying to get below the national average by 2% each year of the project. Our third goal is to reduce or prevent substance use misuse among communities through evidence-based practice interventions. Goal 4 is to decrease the percentage of youth in both middle and high schools who have tried alcohol and marijuana or cannabis in the last 30 days by 1% each year of the project. This goal relates to our surveys that I mentioned before that we invest in that are disseminated to our kids in middle and high school. There are questions on that survey that ask, have you tried alcohol or marijuana in the last 30 days? This is one of our goals, to reduce that, as that number is very high as it relates to our youth trying alcohol and marijuana. Goal 5 is to establish a culturally appropriate prevention and recovery resource capacity among our communities with high substance use disorders, really looking at a statewide approach here and investing in some activities to really bring up our capacity through our state to ensure we are looking at the right things to make a difference in this space. Next is our overdose data to action for states grant. This is year 1 of our 5-year grant. $2.5 million is our annual allotment for this grant. This is also a discretionary grant. It comes to us through the CDC. It's created to help support the response to the opioid crisis. This grant has a heavy focus on surveillance and prevention activities. So really investing in the infrastructure to look at overdose data, to data mine the data, to really identify what is going on and who needs, and what prevention activities or harm reduction activities need to be implemented where. The key objectives kind of at the national level are to enhance our surveillance and data collection in this space. We'll talk about on Friday, we're going to look at some data aspects. And so we'll talk about where all this data currently lives and how you can access it. To strengthen prevention efforts. So taking that data and making decisions based on what we're seeing. As we know, this changes as we surveillance the state and what's coming through our state, what drugs are being used, what people are overdosing on. This constantly changes, and so really having a system in place to look at surveillance in this space, and then linking the data to then implement the programs. Another big push for OD2A through the CDC lens is to promote partnerships. We work very closely with all kinds of people in this space, whether it's law enforcement, hospitals, community partners, just really trying to create partnerships on how we can address and look at overdose data and implement it within our different systems, as all that system work looks a little bit differently depending on what you do and what you're using the information for. So really working together in various different aspects of implementing this. The activities currently supported by the OD2A grant are expanding access to naloxone for overdose reversal. Really, like I mentioned before, really ensuring that everybody has access to naloxone. It shouldn't be a barrier for someone to want to carry naloxone, to have it on them, and to know what to do with it in case it's needed. We'll talk on Friday about what some of the data is telling us about overdoses and how there is a high percentage of overdoses that occur with somebody present. And so really trying to get saturation of naloxone in our communities in every which way we can is important to us. Enhancing the prescription drug monitoring programs. This is done through collaboration with the Board of Pharmacy to ensure we're really paying attention to what prescriptions are being prescribed in our state and what that means as it relates to overdoses and how we can mitigate unintentional overdoses in that space. Training healthcare providers on opioid prescribing guidelines, really focusing in on the overuse of prescription opioids and how overdoses don't just occur from illicit use. It does occur with people overtaking their prescription opioids and not understanding that. So really working with providers to get education through that lens. Improving public health communication to raise awareness about opioid misuse and overdose prevention. And then our big plan right now is creating a Nevada surveillance call to action plan to where we can data mine all of the various data points we have relating to overdose and really doing a call to action on what we need to focus in on or keep an eye on as things kind of are frequently moving in this space. A quick thing about the Overdose Data to Action Grant. There are 2 other OD2A grants in the state that are managed at a local level. The CDC has directly funded UNR for a OD2A program on campus. And then one of our great partners in Clark County, PACT Coalition, is also receiving a local OD2A grant to do some local work in Clark County. So with all that federal talk, I will move into a little bit of information regarding our state general funds. Some of this information gets down to the nitty-gritty, but I wanted to at least highlight this information for those on the call that like to tie things back to state budgets. This information will help you do that. I won't go into all the details on all these slides, but I'm happy to share this slide deck and everyone can have access to it. Right now within our bureau, we have 4 general fund accounts that support all of this work that I just described. We've got CAT 10, which is our general fund account that looks at substance use treatment. We've got CAT 50, which is a substance use treatment general fund account that's through the medical cannabis tax. We have a general fund account for substance use treatment through liquor tax that is captured in our budget account 3255. And then lastly, we have a general fund account that looks specifically at substance use prevention activities, which is in our budget account 3170. So starting with general fund for substance use treatment, we have this general fund account that funds substance use treatment initiatives in our community. Currently, looking at residential and transitional housing. We also fund some very awesome initiatives relating to recovery-friendly workplace activities throughout our state, working collaboratively with our Foundation for Recovery in Las Vegas and our partners at Division of Welfare to really expose this program and get more entities to be included here to really support those that are in recovery that are looking for workplaces and other supports in this space. And then we also fund some peer recovery support services, including the annual Mobilized Recovery event that is hosted in collaboration with various community partners throughout our state. This ledge-approved budget for state fiscal year 25 is $2.6 million. I know the state of the state is tonight, and so moving forward, this may not be the same dollar amount that you see in the budget moving forward. So this was kind of how I started the conversation of this is what we have currently. This current state fiscal year, this is our ledge-approved budget for this funding source. You'll see at the bottom of the next few slides that this funding source is utilized as a maintenance of effort for our SUTR's block grant. So when the feds give us the block grant, they require that we also utilize state general funds to support the initiatives, and we have to report that to the feds. If we cannot meet the MOE, there are consequences to the dollar amounts we have that we will receive in the future as it relates to this block grant. So this is one of the funding sources that we utilize to show the feds that yes, the state also supports these initiatives, and this is the dollars that we do that with. Next is our medical cannabis tax revenue, really targeted at programs within the child welfare space. Our statutory authority here is listed here, both NRS 678C.830 and NRS 458.094. We fund two agencies right now in this space to help really connect individuals in the child welfare space to services for substance use treatment, recovery services. And those two entities are Washoe County Human Services Agency, their child welfare division, and then Clark County Department of Family Services. This ledge-approved budget for the current year is $257,378, and we also utilize this funding source, this revenue source, as a maintenance of effort for our block grant. Next is our general fund account for liquor tax revenue. It's a whole formula that's listed out in NRS 458.094 of how this dollar amount comes to be. The current ledge approved budget is $779,053 per the statutory authority. We currently fund community-based programs for per NRS 458.097. We must utilize these dollars for the detoxification and rehabilitation of persons with an alcohol or other substance use disorder. We do that through two programs right now. If you've heard of the FAST program, which is the Forensic Assessment Services Triage teams that are located within county jails, and to really triage the need for additional services for folks coming into the jail. Those entities listed there receive those dollars. And then we have most teams that are funded by this funding source, both in Lyon County and Partnership Douglas County, to really look at outreach safety teams, community-based teams, not within a jail setting. Again, this funding source is used as a maintenance of effort on our block grant. Next is prevention. So substance use prevention general fund account is used to support substance use prevention initiatives in our community. We fund 11 prevention coalitions in this space to provide evidence-based programs for youth and adults. The current ledge approved amount for this current state fiscal year is $1.6 million. Also used as maintenance of effort on our block grant. My apologies for speeding up. I see that we're getting close on time. A few more slides. I wanted to mention that substance use certification is also housed within our Bureau, as outlined in NRS 458 and NAC 458. The current certifications for substance use include treatment levels of care, prevention coalitions and programs, recovery housing that was recently passed, problem gambling, and then detoxification technicians. The revenue that comes in for certification is captured in that budget account 3170 as identified in NAC 458.103. So a couple things to talk about without spoiling my Friday presentation is a couple things we're working on here at the Bureau as we look at rolling into session and really focusing in on a couple things. We have worked alongside Nevada Medicaid on their 1115 waiver for substance use residential treatment. So that's been ongoing the last couple years. We've just rolled out January 1st with that and are working through the various hiccups as it relates to kind of switching our funding to have everything roll under Medicaid as needed. So that shift is happening right now. Based on that kind of shift of our initiatives, as I mentioned before, this kind of happens. This is the purpose of our block grant, is to kind of fill in gaps in the state and then sustain those programs and then fill in other gaps in the state. So right now the Bureau is working on a strategic plan. This plan will really identify all of the gaps in services for our Bureau as a whole. So as it relates to suicide prevention, gambling, mental health services, substance use services, and really understanding what's needed in our communities by talking to the communities, by engaging in conversations. So we can take all of this information and understand what the needs for funding will be. These and this will result in upcoming RFAs, requests for applications, also known to others as NOFOs. So we will release an application to identify what our goals are and to request community partners to apply for the funds if they have the capacity to meet those needs. Those will be coming out probably this summer. They're getting worked on now, and then with the finalization of our strategic plan, we'll have more of an idea of what that looks like. This strategic plan takes into consideration all of the plans in the state as it relates to opioids or substance use or responding to any crisis services. So it'll take all of those into consideration and really drive our dollars in our dollars in the future. So that's coming. I did want to just say, if you join us on Friday, we'll kind of look at the roadmap of what's for the future. I'll also share some data points and some data dashboards that are helpful as we roll into session on where all this information lives, how we can look at what the data trends are happening in our state as it relates to substance use, overdoses, suicides, all that information, and I will share all that information, and then look at what's for the future. So with that, I just want to conclude that a lot of the work that we do in our Bureau related to substance use is really focused on prevention, going upstream and getting to our youth, especially, before the onset of a substance use disorder. Focusing in on the treatment that is needed within our individuals with a substance use disorder, knowing that everybody's on their own kind of path. It takes everybody down a different road depending on where you're at and what your needs are, and then really supporting those in recovery. We know that recovery is possible. Together, we can create a future where help is accessible and hope is abundant. Really investing in those services and investing in these peers to help us then do all the work. They are really the boots on the ground to help us embed all of these things into our youth, into our folks that are currently in treatment, into those that have gone into treatment a few times. We really know that peers are where it's at. With that, a couple references you can access later and my contact information. So
Stephanie, thank you so much. That was a really fantastic overview of what's going on. Let's go ahead and open it up to questions. For those of you who have questions, if you can please use the raise hand function. I will go ahead and get you on mute in order of who raises their hand first. Any questions? All right, we have 80 people. Nobody has questions, so um, let's see. So that being said, if nobody has questions at this time, I'm going to go ahead and open a poll. I think I fixed it from what happened last time. So you should see a poll. There's two different questions. You should have the option to check all that apply. So what specifically describes your current role? Because sometimes this isn't necessarily captured by our titles. So, do you work in behavioral health? Are you an advocate? Do you work at the state level, local level, etc.? And then the second question is, what topic categories would you like to hear about in the future and from future webinars? So we are looking at fleshing out the rest of this pre-legislative session or series. It will likely go into the first couple of weeks of the session. But if this is something that's worthwhile, then let us know and we can keep moving with different topics and try to get things that you're also interested in unrelated to the legislative session. So I'm going to leave that open for just another little while. While we're doing that, if anybody has any questions at all. Okay, so in the chat, Shauna has a question. When will Medicaid coverage under 115 start and what types of facilities will be covered? Stephanie, do you have an answer for that?
yes, there's various waivers happening within Medicaid. So the 1115 waiver for substance use residential treatment is effective now. Medicaid, we worked with Medicaid, and they had to work through all their bureaucracy to get it all approved through CMS and all that stuff. But it is live now. We went live January 1st with our transition from our funded agencies over to Medicaid. We're still working through kind of the bugs that happens when that occurs. But yes, any residential treatment. So if you're a level 3 provider in the state of Nevada and are certified to do so, you can apply to Medicaid as a IMD provider for substance use residential level 3 and be enrolled and are able to bill Medicaid and the MCOs for residential treatment. They have a CMS approved bundled rate that they are reimbursing for that service. It does not cover, if you're familiar with certification, it does not cover transitional housing and it does not cover recovery housing at this time. So it's only level 3, ASAM level 3 residential services in the state.
Okay, so I close out our poll. So let's see, just to kind of go over that, we have a lot of state level folks here, a lot of people who came in under other, that's fantastic. As far as other topics, we've got innovative practices from other states. That seems to be a winner from both this time and last. That's good to hear. Mental health system updates. We will be doing a series on the crisis response system and what's in store there. If you are interested in learning more about the legislative process and how to engage, please be sure to attend the webinar on the 27th, which is Advocacy 101. Also, that same presentation is going to be given by both Dr. John Packham and Elise Monroy tomorrow morning at the NPHA meeting. So I can send you that information as well. So we've got some great information here. Thank you all so much. It is almost 1 o'clock. I think we can take one more question. Let's see here. We've got, let me see if I can do this. Okay. Any move to regulate sober living programs? That's a good one.
Yeah, so regarding sober living programs, there's sober living is kind of a very broad category. So in the state of Nevada, we just passed certification for recovery housing. So what this looks like, and I'm happy to provide more information if you reach out to me regarding that certification. It is an entity that will provide housing for those in recovery that's not tied to treatment. So a lot of people see that as sober living, although there is structure around it. So that agency does have to provide peer recovery support services, and there's a list of services that must be provided in those houses. So it's not necessarily an unregulated sober living house, but it is a recovery house. So if you're interested in more information on that, I'm happy to chat if you reach out to me.
Fantastic. Thank you so much, Stephanie. So if anybody else has any other questions, go ahead and feel free to reach out to me. Stephanie also put her information in the chat. The slides are in the chat, and I also just got both the slides from today's presentation as well as Monday's presentation uploaded onto nvbh.org. So if you miss getting them when we close this out, then you can always access them there. We really appreciate it. Thank you, Stephanie. We're looking forward to Friday, and we hope we will see you all there.
Awesome. Thank you. Thank you so much, everybody.